Yeah, so the treatment is very different when you are in remission and having a flare, at least for me. I don't know if that's the case for everybody, but for me it's very different. For maintenance, I'm on a medication that seems to be working really well for me as of right now. It requires taking 4 pills a day, every day, but that's pretty much my treatment when I'm in remission. If I have a flare, I still maintain that maintenance medication, but also then have the added use of a steroid to reduce the inflammation. The steroids are getting better. I used to be on a steroid when I would have a flare that could cause more significant side effects. Now there's a new steroid that I found doesn't work as quickly and doesn't give me the relief as fast as I would like, but doesn't have as severe side effects. So for long-term use, it's probably a better option. I just may need to be willing to take time off, more time off from work, and be a little bit more patient with the results. But one thing that affects you with long-term steroid use, especially as a female, is the bone density concern and having too much bone loss. So I've had to go in and do DEXA scans to check for bone density as somebody in her early to mid-20s versus not having to be concerned about osteoporosis until I was a senior. So that's one thing to consider. Another thing to consider is the fact that a flare may have increased risks for blood clots, which is something I did experience. I did, and it's not just the flare itself and the disease. They did attribute the fact that I did have 3 blood clots at once in my leg about a month after my flare in 2014. They did attribute that to also the travel I was doing, a lot of frequent travel, as well as the fact that I was on a hormonal birth control at the time. So between having the flare and the disease, the travel, and the hormonal birth control, they just kind of thought that was just the perfect storm to create the blood clots. And again, that was something that kind of went undiagnosed for a while. I went 2 weeks with the blood clots before realizing that's what it was. I just kind of thought I pulled a muscle in my calf. So now, with having the history of blood clots, now I just have to be careful when I travel. I have to make sure that I give myself shots to thin my blood. If I were to become pregnant, I have to give myself shots to thin my blood. And try to reduce that risk, and I just can't ever be on any type of hormonal therapy again, whether that's for birth control or when I get older, any type of hormonal therapy with menopause. It's just something that's kind of out of the question for me now.